Imagine this. You wake up one morning and something is seriously wrong. You don't think about money. You think about getting help. You go to the hospital. You get treated. You survive. And then the bill arrives. $5,000, $20,000, maybe even $50,000. Suddenly, the thing that saved your life could also destroy your finances. And here's the question. Why is healthcare in America so expensive? Because America doesn't simply have an expensive healthcare system, it has an incredibly complicated one. In 2024 alone, the United States spent about $5.3 trillion on healthcare. That's roughly $15,500 for every person in the country. And compared with other wealthy nations, Americans spend nearly twice as much per person. But here's where the story gets interesting. It's not simply because Americans go to the doctor more. In many cases, Americans actually use less healthcare than people in other wealthy countries. The bigger problem is the price. The same type of medical care can cost dramatically more in America. And that brings us to the first part of the problem. Imagine you need an MRI. The machine is the same basic technology, but the price can depend heavily on where you get it, which hospital owns the machine, which insurance company you're using, and what rate that insurer negotiated. There isn't one universal price. Healthcare has become a negotiation. Hospitals negotiate with insurance companies negotiate with hospitals. Pharmaceutical companies negotiate with insurers, employers negotiate with insurance plans, and patients are often stuck in the middle. That's where things get even stranger. You might have insurance and still receive a massive bill, because insurance doesn't necessarily mean free healthcare. You can have premiums, a deductible, copays, coinsurance, out-of-network charges, and then surprise bills you didn't expect. So imagine an American family paying hundreds of dollars every month for insurance, and then discovering they still have to pay thousands before their insurance covers most of the cost. That's not necessarily because the hospital is simply charging one huge price. It's because the entire system has layers, and every layer has costs. Hospitals need doctors, nurses, equipment, buildings, technology, administration, and insurance companies need to process millions of claims and manage enormous networks.